The MedicAlert Safe and Found program has provided protection to thousands of people living with Alzheimer's and other dementias. With the help of our Blue Emblem ID and the condition-specific health information stored securely in our subscriber health information database. Topics for discussion include how the ID can assist in emergencies and what information is available to first responders. We'll also give you a brief overview of the first responder program, Connect Protect, and a first-of-its-kind study conducted by researchers from the University of Waterloo. While the name has changed, the Safe and Found program, formerly known as the MedicAlert Safely Home program, still prioritizes protecting individuals by maintaining the same essential details. Since 1961, MedicAlert has provided people living in Canada with protection in their most vulnerable moments. We are the original provider of personal health records supported by a MedicAlert ID, and we have gained the trust and endorsement of Canada's first responders. In situations where individuals are unable to communicate, the ID speaks for them. MedicAlert began the program in 2012 when we were asked by the Alzheimer's Society and the RCMP to take on the management of the National Wandering Registry. Since then, we've protected more than 50,000 people living with Alzheimer's and other dementias. The partnership with Alzheimer's Society of Canada paved the way for support from Alzheimer's chapters across Canada and a number of organizations dedicated to assisting individuals living with dementia. When seconds count, it's important for first responders to have access to vital health information. Here's an example. John is living with dementia and occasionally wanders, which has understandably caused significant concern and worry for those who care for him. They remain committed to providing him with the care and support he needs to live comfortably and safely, and are actively looking for an option to track him and prevent him from wandering away. Wearing a Blue Emblem MedicAlert ID is crucial for individuals like John who have conditions such as dementia and may be prone to wandering. While not a tracking device, it contains vital medical information that is essential for first responders in emergency situations. For individuals like John who have dementia and are at risk of wandering, having a MedicAlert ID can be especially crucial. In an event that John were to wander off and become lost, first responders could utilize the unique identification number on his MedicAlert ID to access his medical details. The MedicAlert Subscriber Health Information Database contains crucial details that are vital for the first responder to know. These include the subscriber's emergency contacts, their living arrangements, whether they live alone, with a family member, or in a facility, a current photo of the subscriber, which we recommend upon sign-up. Caregivers can also document the physical descriptions of the subscriber, including hair color, eye color, height, weight, and whether they use a walking aid. Additionally, the database includes information about the languages the subscriber communicates in, previous wandering history, possible wandering locations, and behavior management techniques. This ensures that first responders have important triggers and de-escalation techniques to effectively handle interactions with the subscriber. Finally, all other essential medical details can be found in the database as well. The Safe and Found program provides subscribers with a Blue Emblem ID and a detailed personal health record for an annual fee of $99.99. Caregivers often inquire about the possibility of attaching the Blue Emblem ID to another chain. We recommend to keep the Blue Emblem ID as it is when it's purchased, with a stainless steel chain, mainly because this chain is difficult for the subscriber to remove. It is important to note that the Blue Emblem holds all the necessary information and serves as a crucial component of the ID. Connect Protect allows 911 dispatchers to access a MedicAlert subscriber's personal health record directly from our subscriber health information database. The next slide will offer additional insight into the program. Hi, my name is Peter Lawrence, Manager of First Responder Partnerships. The aim of the Connect Protect program is to improve emergency response times to ensure individuals in need of help receive the appropriate care. Police services that are partnered with MedicAlert in the program do not have to rely on calling the number engraved on the MedicAlert ID. Frontline officers are trained to recognize an authentic MedicAlert ID and follow the Look Read Call protocol. The Look Read Call protocol is an essential part of the Connect Protect program. This process trains officers to look for MedicAlert identification, read the unique ID number, and call their dispatch, who will provide them with the subscriber's health information quickly and accurately. For example, police having access to behavioral management techniques for an individual in distress is extremely helpful in ensuring that the situation is resolved peacefully and without any harm to anyone involved. By recognizing triggers such as agitation or anxiety, police officers can use de-escalation techniques to diffuse the situation, reducing the risk of violence or injury. We are all working together to make our community safer and stronger. Here's an example how first responders and Good Samaritans can utilize a MedicAlert ID. First, the Good Samaritan. A Good Samaritan who comes across someone wearing a MedicAlert ID can call the number on the ID to seek assistance. The operator will ask for information on the ID to verify the subscriber. However, they will not release any health information due to privacy laws and policies. The operator will advise the Good Samaritan to call 911 if the situation requires emergency medical attention, or the operator will call the family member or emergency contact listed on the individual's MedicAlert profile. This helps ensure that the individual receives the appropriate medical care. If a first responder needs to access information about a MedicAlert subscriber, they can call the number on the subscriber's ID to seek assistance. The operator will ask for the first responder's identification before sharing any relevant health information that can help the individual in need receive the appropriate medical attention. In addition, the operator will offer to call the emergency contacts listed on the subscriber's medical profile or provide the contact information to the first responder to ensure that the individual's emergency contacts are notified and involved in their care as needed. As discussed in the previous slides, MedicAlert Connect Protect provides frontline officers with direct access to a MedicAlert subscriber's information through their dispatch operators. It's important to note that the number on the back of the ID can still be called if needed. In 2022, MedicAlert and a team of researchers from the University of Waterloo completed a first-of-its-kind study using 5 years of data from the MedicAlert Subscriber Health Information Database. Here is some of what we learned. 90% of people living with dementia who are registered with MedicAlert and wander are found with no apparent injuries or compromised health. Based on specific characteristics, MedicAlert can determine if someone will wander, and most important, we know the mean time to an individual's first wandering incident. We have a journal that is currently undergoing peer review, expected to be published in early 2024. Once published, the information will be made available for viewing. With evidence-based data like this, we can seek funding to support additional research opportunities. This funding will help enable us to develop innovative technologies that complement the program and further enhance its effectiveness. When we first launched the Connect Protect program, we focused on partnering with police services to provide vital health information to first responders in emergency situations. However, we recognize the importance of expanding the program to include EMS and fire services as well. With the Safe and Found program, we are exploring innovative technologies to alert care partners of a family member's potential to wander. Considering the registration duration of the subscriber as a contributing factor, as mentioned in the research findings, we can make an estimate of the average time it takes for an individual to have their first wandering incident. As an organization, we actively seek to secure funding for our programs to ensure their sustainability and effectiveness in creating positive change. If we secure annual-based funding for the Safe and Found program, we can protect more individuals. Here are multiple images showcasing the Blue Emblem ID, including a zoomed-in image of the clasp and the sample engraving. I've also included the links that provide instructions on securely attaching the clasp. Frequently asked questions. I've documented the most common questions that we receive. So what is the cost to join the program? MedicAlert offers 2 service plan options when you register. There is a one-time activation fee of $75, which helps cover the cost of setting up and reviewing your personal health information before it becomes available to first responders. The monthly fee is $8.50. The annual fee is $99.99 as discussed in the previous slides. Both plans automatically renew until you choose to cancel. It's important to note that cancellations can be completed by calling our call center or sending an email explaining that services are no longer required. It is crucial for subscribers to discontinue wearing their MedicAlert ID immediately and be aware that first responders will no longer have access to their health information. If you are unable to cover the cost of the service, we do have our Inclusion, Diversity, Equity, and Action program, IDEA. Our goal is to promote health and reduce inequities in accessing the MedicAlert service among marginalized and underserved populations. This program works by waiving a portion or all of the cost of MedicAlert services to those most in need. Please note that the IDEA program is not currently accepting applications. Our intention is to relaunch the application process prior to the end of 2023. What's the estimated time for delivery? This product usually ships within 2 to 3 weeks. Please allow 5 to 9 business days for Canada Post standard shipping and 2 to 3 business days for courier shipping. How can I ensure that my personal information on file with MedicAlert is accurate and up to date? Subscribers or caregivers can easily update their file by contacting our call center or accessing their account online. Ensuring that a subscriber's information is always complete and accurate is crucial, as it reflects the necessary details to be shared in the event of an emergency. What should I do if I lose my ID? We're here to assist you in obtaining a replacement ID. You can either contact our call center or place an order through your online account. The cost of the ID is $49.99, but of course prices are subject to change. My information can be found at the top. I'm available to address any inquiries or offer assistance, so please don't hesitate to reach out to me, Peter Lawrence. I've also added the dedicated Safe and Found phone number and website, along with my direct report, Stephanie Tan, and I've also added our YouTube page. Thank you.